the president and chief executive officer at Virginia Hospital and Healthcare Association, a huge title, big job, healthcare, big issue in the United States and in Virginia. Sean Connaughton. Hey, Sean, great to have you with us, man.
Hey, John. Hey, good being back with you this morning. Hope you're doing good.
So I tell you what, you only deal with hospitals when you're not in the hospital business, Sean, like you are, when you either go or somebody goes. So my mom, who I'm not going to tell you how old she is, but she's a lifelong Republican, and the first person she voted for was Wendell Willkie. So that'll kind of give you a little insight there. Anyway, my mom, Dolly, just got back from the hospital. And she's been there 2 times, Chesapeake Regional. Yeah. And, boy, they do a fabulous job. I mean, they're fabulous. They really do. Yeah,
in fact, they're one of our members, and they really, when you look at the great care that they give to the people in the Chesapeake area and then also for those in North Carolina, it's amazing how many people travel, actually. I've been down there, and you meet some of the patients, and people could drive fairly long distances to come to Chesapeake General. They do a really good job.
You know, but see, it was real easy because my mother's on Medicaid because she's obviously a senior. And then she has the gap insurance through AARP, which is one of the organizations that offers it. So she's pretty much covered. But there's a lot of people out there who are not, or their deductibles like mine are $10,000, $12,000. And, you know, one of the issues is what are we going to do about this? Sean, and your organization, you represent about 100 Virginia hospitals. By the way, for our audience, Sean is also past Virginia Transportation Secretary and a former Prince William County Supervisor. And, Sean, the last time we had you with us, we were all awaiting the Supreme Court's decision for King versus Burwell. Now, that's done. That decision came out a couple of weeks ago, and it upheld the tax subsidies that enable Americans to purchase private health insurance under the Affordable Care Act. Now, what exactly does that mean for the 100 Virginia hospitals, Sean, that your organization represents?
Sure. I mean, what the subsidies did, or what the case did, was affirm that in states like Virginia that do not actually have a state insurance exchange, that they can actually go to the federal exchange and then receive the subsidies. The law wasn't clear. The Supreme Court ended up ruling that people who bought policies from the federal exchange could also receive the subsidies, which enables more people to buy insurance, which means that there are additional 400,000 more people carrying insurance and having the ability to access our great health care here in the Commonwealth, and also to ensure that the hospitals get paid. One of the challenges that we're facing right now is, you know, with the Affordable Care Act, Obamacare, people, we've had all types of policy fights and all types of political fights about it. The challenge is that it's been around for 5 years. The hospitals and health systems are out there obviously doing a lot of things to actually comply with the law because we have to. But one of the biggest challenges is why we were so concerned about this Burwell case, this Burwell v. King case, is that, you know, right now there are massive cuts coming to the Medicare program. As you mentioned with your mother, she's one of those people who are, you know, dependent on their Medicare to get health care. And right now, hospitals are only receiving about 85 to 90 cents on the dollar for the reimbursements for the care they provide. That's going to get worse. In fact, this year we're going to see, you know, almost $400 to $500 million cut just to Virginia hospitals and reimbursements, and those cuts keep on escalating. And obviously, the concern we have is that how do you end up providing great health care if you're only getting, you know, 80 cents potentially on the dollar? Medicaid, we only get 66 cents on the dollar, and then because of charity care and, you know, providing care to the poor, you got 6 or 7% of the people don't pay anything. So you just think about it, John, about from a business model, how are you going to keep those doors open when almost 2/3 of your patients are people that pay either, you know, 80 to 90 cents on the dollar, 66 on the dollar, or pay nothing at all. It's not a good future for us unless we start to have a real dialogue about how do we pay for health care here in Virginia.
And I'll tell you, Sean, the other gap that isn't even showing up in any of this, but I've been predicting for some time is going to start to show up in the numbers, is that the number of people today who don't have health insurance through their company, and so they're independents or whatever, and they've got $10, $15, $20,000 or 10 or 12 or $15,000 deductibles like I do. Well, if I went to the hospital right now, I can tell you straight out, I don't have $12,000 lying around. So maybe I'm going to pay some of that. Maybe I'm not. I don't have any idea. I'd have to borrow it, figure it out. But there's going to be a lot of people that are going to go in. They can't pay the deductible. The hospital's out that money. And that's not even in your numbers.
That's right. And in fact, we are definitely seeing an uptick in quote-unquote bad debt with people, due to people with these very high deductible plans like you and actually like us here in our association. We have a fairly high deductible plan with with one of those health savings accounts. And so when you look at that, now the good part of that with these plans is that you're seeing people make better choices, consumer choices, which is going to, and potentially in the long term, at least for preventative care and some of the lower end or the stuff other than emergency types and acute types of treatments, people will make better choices. The thing is that when you do have some sort of major issue, then you start to look at the fact that are you going to be able to pay for it with those high deductible plans? And then on top of it, what does that mean to the hospital when you can't pay that $15,000 potential deductible?
This is just a big issue. We're with Sean Connaughton, President and Chief Executive Officer at the Virginia Hospital and Healthcare Association. All this discussion of the economy makes me think about today the recent news in Virginia, this so-called $553 million state budget surplus announced by the powers to be this week. The Maxter, Governor McAuliffe, and other legislators from Bill Howell on down all took credit for the surplus, even though it's the taxpayers' money. But of all the coverage on it, the piece that stood out to me was an editorial in the Virginian Pilot Sunday that argued the surplus is really built on budget gimmicks and that substantial savings would have come to Virginia if the General Assembly could find a compromise on some kind of contested health care policy. I was wondering if you could give me your thoughts on how we solve this.
Yeah, actually, what they're referring to is that if the state were to accept the Medicaid expansion money, there are a lot of state programs that would become duplicative, and so that we wouldn't have to spend money on it. So the state does have various programs that it provides care to the indigent and for other populations in the state, so that if you had Medicaid expansion, you wouldn't have to have those state programs, which means that would be hard money, real money, that the state could then turn around and use for other programs or return to the taxpayers. And it really just broadens this issue about, health care. When you talk about the economy, people seem to not understand that actually one of the largest employers in the state with the largest economic imprints, that it's in every corner of the state, is healthcare. In fact, the hospitals alone employ almost 120,000 people, another 300,000 people in other facets of healthcare. So you're looking at 1 out of every 9 jobs in the Commonwealth are tied either directly to hospitals or to the healthcare sector. And so we're a major part of the economy. In fact, if it wasn't for healthcare continuing to hire people, particularly to deal with our aging population, we would actually have had negative job growth last year. So you look at these things and you kind of go, the healthcare community is a major player and also helps contribute to that surplus that everyone's taking credit for. And in fact, if it wasn't again for our growth and some of the things that are happening in healthcare, that surplus would potentially be lower.
Well, here's the bottom line. Obamacare is not going away. I don't like it. You might not like it. There's a lot of things I don't like. At the end of the day, it is what it is. It's not going away anytime soon, no question. You've got 10, 12, 13 million people getting health coverage now that have either it's 100% subsidized, 80% subsidized. They didn't have it in the past. That entitlement is just not going away. I mean, I'm just going to be honest. We've got 400,000 Virginians caught in the coverage gap. And here's the deal. There's got to be a compromise because when they get sick, Sean, what they do is they go into the ER. And they get fixed up. Whatever happens, that becomes part of the indigent care. That raises the dollars. I mean, we're paying for it either way. There's got to be a compromise here.
And John, you know, this is it. No matter what people tell you, this is an indirect tax because what happens when the indigent do show up, they don't pay. Somebody's paying for that because those hospitals, the costs are the costs, and so they're going to have to find ways to pay for those services to the indigent, and then also for Medicaid and Medicare, where they're not. Again, the federal and state governments aren't paying their full amounts. And the issue is for you and for me and everyone else is how do we make sure that, you know, we change this dialogue from the politics to focus on what's really happening due to the Affordable Care Act. And again, everyone's focused on the insurance, on the coverage, and some of these mandates. They don't realize that the law's making direct cuts to the providers who are being asked to change their whole business model. In fact, you're seeing throughout Virginia right now a great deal of consolidations, integration of services, because now a hospital is more than just a hospital. It's really a system. It's not just simply multiple hospitals, but it now is providing you for coverage from cradle to grave. And that's what we're being asked to do. That way we can end up potentially helping you through every stage of your life to live a healthy lifestyle. The thing is, those comes with costs as well.
Well, that's the thing. We got to get the politics out and find a way to deal with the reality of the situation. So, Sean Connaughton, what is up? What is coming up with Virginia Hospital and Health Care Association, and what's on your agenda now?
Well, one of the big things we're going to be embarking on is a little bit of a public education campaign to get the word out to people about how important hospitals and health care is in the state, then talk about some of the challenges that we're facing, some of these things that we're talking about right here, and then hopefully get the policymakers here in Virginia to really focus on what's happening in their hospitals, what's happening in their communities, what happens if the hospitals and the systems aren't there to support them. And then we would hope to have an honest dialogue with the General Assembly, with the McAuliffe administration, about how do we work together to make sure that our health system here is not looked upon as a liability, it's looked upon as an asset, that we stroke this great job engine that we have here in Virginia that's in the healthcare sector, and then we make sure, I mean, we talk about economic development. If we don't have good health care, if we don't have good hospitals in a community, no manufacturer, no economic development prospects going to show up to that community, which is some of the challenges in many places in the rural part of the state, where almost half the hospitals are operating in the red right now. So that's our focus for the rest of this year, and it's really get the people to reintroduce them to their hospitals, because sometimes I think, like yourself, like with your mom, I mean, people only think about when they really need it versus understanding that it's there 24/7, and these are critical parts of your community.
You know, and the bottom line is what you just said. Half the hospitals are operating in the red, and when you look at hospitals in rural areas, they're getting hammered, services being cut back. We don't live in a rural area. I live in Great Bridge, Chesapeake, so I was able to take my mom. It's 5 minutes away. If I had been in some other areas, it would be an hour and a half, so it just wouldn't be so easy. So we have to keep this debate up and solve this and get the politics out. I want to thank Sean Connaughton for being with us, President, Chief Executive Officer at Virginia Hospital and Healthcare Association. And if you want more info, VHHA.com, VHHA.com. Sean, thanks for being with us, man.